I am calling to order the December 18th Board Quality and Compliance Committee meeting. And Sharon, I'm assuming you've taken a roll call?
Yes. I've noted who's here.
Thank you. And can I get an approval of the agenda, please?
Move to approve.
That was Dr. Rassner.
A second?
I can't hear you, Deb.
Deb, you're muted.
I know. I was just going to say, I will second. And I don't know if Lisa reached out to say that she can't attend. She couldn't make it today.
I didn't hear
She-
anything from
Thanks for that, Deb.
She something about her flight. She just flew in, or she's trying to get in. So
And it's not nice there, is it?
no. So.
Okay, that's too bad. All right, public participation. Is there anybody who would like to provide public participate questions or comments? I'm assuming there's nobody there, Sharon, correct?
No, there isn't.
Okay, great. We will move on. If I can get approval of the minutes, please.
Move to approve minutes.
I'll second.
Thank you. Let's move right on to old business. Board quality dashboard.
Robert, do you want to start with page 1?
Sure thing. If you want to speak to some of the employees survey stuff, Gail, I'll do the rest though.
Okay.
Okay, so hopefully you have that in your packets, the correct version. Current conditions in most cases are going to be Q3, and I hope you can hear me okay.
Yeah, we
So
can
I'll
hear
just
you.
I'll just run down this real quick. So I want to maintain accreditation readiness status at all times. We're doing that. We haven't had any catheter related bloodstream infections since 2008. Our readmissions are essentially in Q3, essentially the same, slightly lower than in the second quarter, but very close. And of course, we maintain our CMS 5-star rating. Our sepsis has improved slightly from 63 to 65%. We're proud of that for the third quarter. Falls with injury, we did not have any in the third quarter. Our injury rate is our falls without injury rate slightly higher for the third quarter. Had a few restraints, nothing remarkable there. One additional surgical site infection for the third quarter. Had no catheter associated urinary events, no C. diff, holding strong at 79, which is less than the goal for hand hygiene. I'll skip over the survey stuff. And Gail hit that at the end. Our HCAHPS, as far as overall rating, is staying at same as Q2 at 81%. Still can't quite hit that elusive 85. And then our likelihood to recommend is up a little to 85%. And something that I'm looking at, I communicated this to Gail earlier today, but starting to see a little bit of some synergy between our 5-star rating with CMS and our patient comments. Seen one for sure and two that could have been where people are referencing, giving us good HCAHPS scores and ratings in other areas of the hospital, patient surveys, and they're referencing, or maybe they're alluding to the fact that we've achieved that 5-star rating as the word gets out, and hopefully with the leapfrog stuff to come, we'll have maybe some synergy there, and maybe perhaps a higher HCAHPS rating. ER median time is up a little again at 186. We do have a physician engagement survey that is still active. It's going to close here in a couple weeks, but That one, we don't have any data there as it's still underway. Patient family engagement, PFAC meetings are being held. The OR metrics, I don't have an update to either one of those. And then Jeanette CDI, she went from 96 to 92 on her carry forward rate. And that is the first tab of the dashboard. Anybody have any questions?
So I have a question about hand hygiene. I know that has kind of been the nemesis, and it looks like it's holding steady, which I guess is good. But are there any other ideas or things you guys are trying to do to meet that 88%? And I know there's some challenges here.
Shelley, I can speak to that. We actually have a new A3 started on that because that is a focus of Leapfrog. And Charlie is working on that with our clinical directors. And she just did a presentation with our nursing leadership. And we're trying to improve that in 2026. And I can bring that back, her A3 presentation in the next holiday packet.
Okay, that sounds good. Thank you.
And then what Robert did not address, and I'll just let you know, you have a little preview of the safety scores on this dashboard. I updated the current conditions. I have not updated our goals yet because I will be doing an A3 on our safety and our reporting goals. And that will be in our quality plan that will be presented to the board in January. So you do see some of the new scores that are coming with our Frescati results, but you will be getting the full information when we get all of those results to you. We have some good news and we have some improvements on those. So we'll be getting the full report to the board probably in January.
Okay. And let's see. I did have a question. I'm just trying to find on page 6. Are you including that with what we're discussing now, page 6? Because you said the workplace safety.
I have not done that yet. I can do that next.
Okay, perfect. Anybody else have any questions on Robert's information? Okay, let's move on to the workplace safety.
Okay, workplace safety trends for Q3. What you can see is we had some decreases in some of our emergency services. We do have some of our trending of our professional conduct. These are professional conduct, to remind you, these are internal reports of either staff to staff or staff professional physician relations reports. So they're pretty much the same from quarter to quarter. Trending, we had a few increase of physical encounters with emergency services. That was actually one patient that had those bump on those encounters. And then in inpatient services, you saw that increase, and that was actually a single patient that increased those. And then the JPD call to campus was in relation to 2 patients.
Okay, that answered, you answered my questions. So anybody else have questions? Okay, moving on to the medication dashboard.
Great, thank you. So the medication dashboard, this is going to be another A3 that you're going to see coming out in 2026. We're actually doing a focus on decreasing medication errors. And actually, I shouldn't say a lot of these events are not errors. These are good catches or near misses. So I'd like to see that our reporting has gone up on our medication events. So that has been good tracking over the last year. So a lot of our reporting has come in by pharmacy. A lot of these catches have been expired meds still in our Omnicells, and some of that had to do with our staffing turnovers through pharmacy this year. So that's where you're seeing the trending up in that area. Med surge, that I think had to do a lot of with the turnover and the training that we saw. We had more good catches on med surge, even though their number went up. A lot of those were not reaching patients, which I'm pleased to say that they increased their reporting, but it was not reaching patients. And then the other events that I thought were coming up that should be solving is the events in our surgical services with the changing of our anesthesia system and being able to track our medication administration by anesthesiology through to pharmacy. That continues to be a challenging med process and tracking of our storage of our medications. Any questions?
So I'm guessing that you guys are working through the Omni system to make sure that all the expired drugs are caught now.
Yes, we have more what you call is the pharmacy technologists that are doing the restocking of the medications. That was a challenge for them of having enough staff to support the pharmacists.
Okay, great. Anybody else have questions? Okay, moving on to the lab dashboard.
The lab dashboard, this is our blood culture contamination by department report. We're just trending this through. As you can see, we've had a slight increase, which was expected, and part of that is having the volume of travelers that we get in our emergency room. So lab is working on a process improvement again with our emergency room, and hopefully that trend will go back down. But all of our other inpatient units, CCU, med-surg, OB, same day, and then lab are holding steady. So what they are doing again is working with the staff down there, identifying where the process is, if it's any of our permanent staff that are having problems with drawing blood cultures, or was it just travelers coming through? So that's a constant process to make sure that we are having any trends on there.
Okay. Do you know, do other facilities have challenges with travelers and incidents?
Yes. Yes.
I would assume so. Okay, does anybody else have any questions? All right, the Wildflower Court dashboard, please.
If you could make that as big as you can, please. I cannot, yeah, I've got my own paper, because I've got a few things. I just like to see what everyone else is. This is, I think this has been presented, has it? Brand new. Yeah, so we're gonna start presenting some Wildflower Court data and in the dashboard. And so I'm working with Robert on, he's been supporting me in putting this together. Although it was my desire to just, of course, choose everything that we were doing really well in. I knew I was gonna have to sit next to Gail and look her in the eye, so we have things out there that need improvement. So,
Look at line 3.
yeah, well, we could start with that. Maybe I'll end with that. So just to give you a feel, and these are going to be really dynamic things. It will change probably frequently. We have 20 plus indicators, quality measures to choose from related to short stay residents and long stay residents. But I've just got stuff out here. Robert and I have put stuff out here that really needs improving and things that we thought were really valid to looking at for you guys. So, and I don't know if you've all had a chance to read or have any questions, but I'll just very briefly, because it's a short list. Maintaining our accreditation, of course, so survey readiness and how we do there. So we are currently meeting that goal of just 2 pass. And then our ER visits, pretty standard, want to be kind of less than 5 there, doing all right. But it always work on improving.
National mention?
Yeah, these are going to be national, all of our kind of anything under the goal is going to be from CMS for nursing homes. And then I guess I'll just dive in instead of saving it for last. It should have been the last thing. Only went from 1 star to 4 stars on our, so if you go to nursing home compare right now, it'll show us as 4 stars. And what was holding us back was a survey health inspection. I guess it's under health inspection that we had, I believe, 4 years ago. And surveys are on a 3-year cycle. So that very poor survey or health inspection we had did finally fall off. So, and also our quality measures took a bit of a bump. And so, and then we didn't get it refreshed as early as we were hoping to have it this summer, but then with the government shutdown, everything was still, so finally, I was very excited to see we're up to 4 stars again. So, and our staffing and quality, staffing's at 5 stars, quality measures at 4 stars, and health inspections are at 3 stars. So, and that's meeting our goal. We were hoping to have it by next spring, but now it's going to be about maintaining and making it even better, like 5 stars. That's what I'm thinking. So we can match the hospital. So a really kind of not so great number is the next one, and that's our residents experiencing falls with major injury. We are looking at falls. We've had quite a few falls recently. Believe it or not, even though it feels like it's a ton of falls, we're still below national average, although Q3 wasn't there, but we're at the 22nd percentile for falls nationwide. So, lower number, the better. Something we're actively working on. I don't have a lot else to share at this time. Well, actually, a lot of these metrics, I really don't have a lot to share, just letting you know we are kind of homing in on these pieces, and that's what we're going to be looking at as far as process improvements. Next one is our long stay residents with pressure ulcers. This is quite a high number for Q3, but just to give you an idea, we're looking at 9. This number came from 9 residents out of 49 who qualified to be in this measure. So I just looked at the board before I came over in the nurses station just to see where we're at right now. And that actually matches up to what we have in house. But, CMS is looking at new or worsened pressure ulcers, new or worsened pressure ulcers between stage 2 and stage 4. So, some of these could be as simple as skin, like a bad rash or something, and it could be as bad as an actual pressure ulcer. So I haven't done any diving into the patient level data at this point, but that is, I will be doing that in the future, just so I really know what's going on here. The next one is the percentage of residents who lose too much weight, something we eye very closely. We have weekly meetings related to weight loss. Now, this does look quite a high number, 8.2%. The average is 5.6. I'm actually quite confident, and you can see calendar year 24 was even higher. We did discover some actual, not weight, but the actual taking somebody's weight issues with the process. So I'm not even sure the accuracy of that number. We work weekly with our dietitian, and we calibrated our scales, and we process for, weighing wheelchairs and walkers on the scales. So I'm hoping to see that number drop, but we are flagging, so we are looking at it. Robert has been supporting us in the hospital, Robert Johnson, as far as making sure that our residents have more options. That's been part of what we're looking at as well. So, yeah, working on that one. We did have our resident satisfaction survey. A little bit of a boost compared to our previous year, but only. Robert, was that 61% response rate or, right?
No, that's the question was, how satisfied are you with medical care provided
that's
by
right.
staff? And it
That's right
was,
there.
it came up from 48 to 61, goal was 55.
And then how many of our residents actually responded?
I don't have that. It was comparative to last year. It's a few residents higher.
It was just a few, yeah, so I think it was. about
Residents and
half.
family.
Yes, so residents or family, we have some residents who can't fill it out, or either their family member or appointed person filled it out. So I don't think it was actually, I think it was like right around the half, about 50% mark, so. Probably push for a little bit more next year. Of course, we have our employee engagement, and that was from our Press Genie survey. Like we're meeting our goal on that, and then our average daily census. I might adjust this number, 57, that would mean we'd have to have 57 every day. That is my goal. Understanding that's
Is
not.
that-
I know, right? Like every single day, I'm like, maybe that's not entirely possible, but I think if we're like reaching it, right? So, a week and a half ago, we had 57 and today we're at 52. And a couple of discharges we weren't expecting, and then, then all of our rehab patients decided to leave in the same week. So, just understanding a little bit more how that works. But we are improving that admission process every day. I'm actually really excited. I'm just a prelim announcement. We're looking at improving our process even with the hospital and streamlining it. And so working with Dr. Tainer and Jeanette. So we just want to make a very easy thing to do and cut back on the days it takes to get residents from the hospital to Wildflower Court. So this is going to be something we're going to just continue working on.
Yeah, or maybe you could do like days to admit or something.
Oh,
Yeah.
from Bartlett to Wildflower Court.
Yeah.
Really good one we could measure.
Yeah,
Do you have A3s in these processes?
No,
that'll be the next one now that she knows her.
Well, actually, I have a meeting with Jeanette tomorrow to start a E3 on this exact thing.
And the three of
Yeah, we don't have any E3 started on this.
That's why we started the dashboard, so then she can have A3s to work on.
Have some actual, so, but yeah, I'm having a meeting with Jeanette tomorrow about that bottom one. So that's something that's,
Why is the one yellow?
I think that's like working towards our goal. I think it just didn't get turned to green. Usually it's in progress and black if we're.
Because purple wasn't available, Joe.
That's our giant presentation.
I think it was more for just like Robert and I, our discussion, maybe I'm not sure. But it really should be green, I guess. It'll be green next time. So, to keep it clear. Does anybody have any questions about our metrics or the new dashboards?
Is there anything that the board would want that is not on this dashboard?
I have a comment.
Go
To
ahead.
Shelley. Okay, yeah, for Shelley and Deb. So I'm on the quality committee for the hospital, and these really do mesh, I would have to say, with what's going on at the hospital. In terms of A3 hand washing, I was going to extol the virtues of having our own dedicated infection nurse, and then Charlie showed up. I think if my suspicion is that the nurses do better than the doctors. Is that a fair assessment? Or, yeah, so I've made a personal attempt to be more clean. I mean, I'm hyper clean, but even more so. I think if we just keep after the docs, this will get better. Workplace stability, very stable. There's nothing really going on there. In terms of the A3 on the meds, I feel like our meds errors have gone down. I think we've done better with documenting. So the trend over the past 10 years has been better. In terms of lab blood culture, there's always this little blip back and forth. That's sort of background noise. Same thing with Wildflower Court, although we've had a little bump in pressure sores and catheters. Remember we had those? That because those hit so hard in terms of our CMS reporting. I'm glad that we're focusing on that. But all in all, it seems like this meshes very well with what the hospital is, and there's nothing major.
Yeah, I would just comment and say it's great to see that the dashboard's been developed and now you'll be using the A3s to meet some of these goals. So appreciate that. Thank you. Any other comments or questions? Okay, let's move on to the diversity and inclusivity.
So this is one that we put on the back burner for a while because we weren't sure how things were coming with all of the changes with CMS and changes with the political climate. I just wanted to let you know where we were in 2024. And this actually will probably have to be built out and will have to be managed on some areas because CMS and parts of our government are still tracking this. So I just wanted you to be aware of where were at the end of 2024 and that this will be coming forward and we will be doing tracking in 2026. So that's why I included it in here and I just wanted to give board quality a heads up that this will not be going away like we thought it would. But CMS is still not sure what they're tracking or if there will, I doubt there will be penalties this coming year, but we are still having to track.
Good information to have. Thank you. Any questions on that?
Yeah, if I could. So Gail, this is questions of what specifically?
Social determinants of health and equity. So part of that is we have to ask what they have at home. So there's a whole set of questions we ask when they come in the hospital. You know, do you have housing? Do you have, you know, utilities? Do you have food? Do you have, you know, all these things that are available, transportation and that? Not that the hospital can provide that for you, but it's a lot of data gathering. And then if they do have these inequitable things, we're supposed to be able to provide them with resources to go to. And then we're supposed to determine, you know, are there discrepancies in our population that we somehow should be addressing as a whole, as a hospital and as a community. So, and there's things that they're requiring us to build out in our EMR for tracking, like the one big thing right now that we have to build out is tribal organizations and affiliates. And they're not sure there's discrepancies between our Meditech and Tegria on whether or not we have to build these out or not build them out, and different things that we're having to ask or not ask. So there's a lot of misinformation coming from that's being asked of our organization and lots of organizations. Still mass confusion.
Okay, any other questions or comments? Okay, let's go ahead and move on to the patient safety structural measures.
All right, so this is one that we have been working on for a while. I wanted to just let you know, and sorry, Joe, I don't have red and green. Again, I'll just call it a CHAD dashboard. So I realized afterwards I kept my yes and no's all the same color.
Blow that up so we can read.
So this is one that we attest every year, and this has a very high level of board responsibility. So I wanted to let the board know where we are and what we are working on for the PSSM, patient safety structural measure, and where we are having to move forward. So the one in the domain number one, the leadership commitment. One measure that I'm going to be working with Anita on is reporting on patient safety and workforce events initiatives. And anytime we have something that's related to patient safety or quality is just having it somehow acknowledged on the board meetings. So not on this meeting, but on the regular board meetings, is just having a little notation next to it. So that way, when we have to pull it and identify it for CMS, we can account for the time spent on quality metrics on board meetings. So when our med staff report is given or other things are given, like a A3 presentation and things like that, we can account for the time spent given towards quality compared to given towards finance on our regular board meetings. So that is something that I'm going to be working with Anita in the future on, to make sure that we have accountability for about 20% of our regular board meeting agendas that we can attest to. On domain number 2, forgot to wear my glasses. Working on our patient safety. Thanks, guys. Our patient safety curriculum and competencies, we need to look at this. We just moved to a new platform called HealthStream, and I just need to work with Jenny and Lauren to attest that we have everything built into that system that we need to, because that is a new system that we'll be using in 2026. In domain number 4, which is our accountability and transparency, making sure that our patient safety metrics are tracked and reported. So this is an interesting measure. So CMS wants our metrics that are tracked and reported on all clinical and non-clinical staff and made public in hospital units. So this is something that we will need to develop an area in our clinical units where we have dashboards or information that our public, when they walk onto a unit, knows how well each of our units are doing on measures that we want to report publicly, like things like falls, like pressure sores, or our staffing ratios and that. So when you walk on med-surg, there might be an area where you see the nice smiling pictures of the staff, but also other metrics of how well we're doing and things like their process improvements they're doing. So that's something we haven't gone out for, our transparency for our hospitals. So that's something we're going to be working on in 2026. The other thing we're working on that I started talking with our med staff that we're going to be working on is an evidence-based communications and resolution program. It's called a CRP. This is something like a candor program. So if a never event happens, so like if we had, say, a surgery where a sponge was left in a patient or something happened that should never have happened and you have to disclose to a patient, you have a evidence-based program of how to talk to the patient, when to talk to them, who talks to them, and how you communicate through the patient. It's a program that is evidence-based and is standardized through the hospital. So that is a program that we don't have at this time, but we are going to be putting in place. We do this already, but we don't have it as a standardized program that all physicians and staff have gone through training. So we have a policy in place as a hospital policy, but we need to have an evidence-based program for CMS. The other thing that we need to do in domain 5 for our patient and family engagement is to have someone from our PFAC, from our Patient Family Engagement Committee, is to sit on this committee or a hospital quality committee. So that way we have a member of the community who has either been a patient or a family member of a patient to sit and talk and have that patient perspective on our quality meetings. So we have a couple candidates for that. We will probably set up a an application process. So that way, when we have someone apply to the committee, they understand confidentiality and the process of sitting in on a high level committee such as this. But that is the last thing that we will be doing. And then we'll be able to meet the whole standards and we can attest to it. Any questions?
Got a lot of things in the works.
Just one or two.
I'll look forward to, I guess I won't be looking forward to seeing what happens. I'm gonna have to get it from you, Gail, on the side.
Have you been a patient?
Not in a while. Okay. Anybody else have any comments? Okay, we'll move on to the grievance report, please.
So we've had 10 grievances that we worked through since we met last time. Nothing terribly out of line. A couple of things we were able to do some process improvement, have training for staff. Had a couple of billing things we were able to work through. Communications with patients from out of town, trying to get some procedures done without having orders done. So some of the complaints were a little bit more about being frustrated and not understanding the process. Any questions?
I have a question.
Okay.
So Joe and Gail would know this. There was a grievance that was articulated at the board level, actually, a letter sent about a patient. Remember that? About some inappropriate charges maybe during surgery. I don't know. Did that get to Beth's desk? Any chance we were going to decide what to do about that? I can.
That was the one that had multiple issues. Because there were
It did.
things in PAS, there's things in surgeries,
Yeah.
there's a thing on the nursing.
Yeah, and then there's a thing about inappropriate billing. It was about 2 months ago.
Yeah.
Okay, and so is that maybe Beth, do you know, Gail? I'm not sure if that's public.
Yeah, she would have been there.
Okay.
She was looked into it, and I know there's multiple people in this particular.
And we're going to respond then to that specifically. Okay.
Yeah, we wrote her a letter.
Oh, okay, great. I just hadn't seen that before. Thank you. Thank you.
My only comment would be is I think it's so important that these are addressed quickly and you guys are doing that. So it's nice to see that they've all been addressed by the time that we're seeing them. So thank you. And I know that takes time.
Some days it takes a little bit longer depending on what research needs to be done, but we do. We get out in front of them as best we can. As we can.
Okay, compliance data report.
All right, thank you. All right, so almost done with fourth quarter, but where we're falling, actually where I'm falling out, I will tell you right now, we are in the process of doing a cleanup in policy tech. So the one thing I have fallen back on is just updating. I have some policies and procedures that are compliance ones that should have been on a 2-year cycle that I failed to realize that they are on a 1-year cycle. So we're doing a cleanup in policy tech. So that's where my failure is, that I am behind on, because they were all listed on a 1-year cycle and they didn't have to be on a 1-year cycle. So that is where my policies and procedures are down on this. Other than that, most of my compliance investigations that have been coming through are potential HIPAA breaches and a few confidentiality issues that have come through under the professional conduct ones that I've had, that I've investigated, and I've had a few that have gone over to HR. I think are most of my issues that have come in that I've had to clear in the last quarter. Those are the most common issues that have come through. And then on the repayments and overpayments, I know I have Tammy online. Do you want to talk about that? I know Shelley had some questions on it. I don't know if you can talk, Tammy, or do you want me to just go through the numbers for you?
Yeah, sure. I'm sorry, can you can you scroll down? Okay, yeah, thank you. So for the third quarter, we did not have any internal audits by the compliance team. We'll have a billing compliance audit where we select a Department of Service in review internal accounts, and we did not have any for the third quarter. So there's no data to report there. As far as claims for internal monitoring, we had a total of 114 claims and found 70 of those needed to be refunded. Either it's the insurance overpaid because the patient had an additional insurance, or they processed their benefits incorrectly. So we found 114 of those. 70 of them had to be repaid and were paid within 60 days, and that totaled $41,327.07 for the third quarter. Government audits for the third quarter. Last quarter, we had 12 of them, which happened to be cataracts, where they had taken them back a couple years ago, and then for whatever reason, again, resurfaced those exact same claims for a handful of them that still needed to be refunded. But this quarter, we didn't have any. We didn't receive any RAC audits for the third quarter.
Great, that helps. Those answered my questions that I had, so thank you, Tammy.
Sure, you're welcome.
Yeah. And then Shelley, we usually do more internal audits. We have it set to do Wildflower Court, but unfortunately with me being gone quite a bit this fall, we've missed our audit. So that was our next audit. So we're gonna have to catch up in the beginning of the year.
Okay, yeah, and that'll be good to do. So thank you guys for including that. Okay, anybody have any questions on this? Okay, guess that completes our agenda today. Are there any committee comments or questions?
I have a comment. I think we're doing well. And my other comment is I feel sorry for smaller hospitals that have all of these mandated trying to collect data on people's living situations and then posting data on, this mine has not had a dangerous accident. I mean, I think that's all great, but I'm thankful that we have at least people that we can do that. But what does Petersburg do, or some of these other small hospitals? So
They have different standards because they're criticalized.
Yeah.
Yeah.
Okay. That's another discussion. Thank you.
Anything else?
That's for a small big hospital.
Yeah.
I do have one thing I wanted to say. I'm sorry I got interrupted. Shelley, thank you for all your service on this committee. You've been, brought a lot of wisdom to us.
Thank you. It's been a pleasure to be on the board and to chair this committee and work with Gail.
We're going to miss you.
I'm going to see you guys too. We'll see. I may be back sometime.
That would be great. You can always pop in as a member of the public or,
I can, can't I?
yes, you can. Thank you.
All
Shelley.
righty. Well, and I want to thank all of the members of the board and of Bartlett who have contributed to the quality. It's a big job and it's usually not I never classified it as a fun job. So thank you guys for committing to it. And with that, I will adjourn this meeting.
Thanks, Kelly.
Thank you.
Thank you,
Thank you
Shelley.
guys.